Hi, my name is Hannes Koorn from South Africa. Just a general GvHD question. We often obviously use donor lymphocyte infusion post-transplant, even a couple of months post-transplant, either prophylactic in relapse disease or preemptive with evolving mixed chimerism. If you give DLI and someone develops severe GvHD a couple of weeks down the line, do you follow the chronic or the acute treatment route?
Very good question. I guess it depends on the clinical features, but maybe I will let Florent handle this one. GvHD after DLI, how do you manage? Is it an acute-like phenomenon or chronic-like phenomenon or both?
It will really depend on the aspect of the graft-versus-host disease. It's really a clinical diagnosis. If you have truly the feature of acute graft-versus-host disease with absolutely no chronic feature, we'll treat at acute with 2 milligrams per kilo prednisone. And what is the most frequent is more to have some kind of overlap syndromes in this kind of patients. And we know that most of the time overlap syndromes is more difficult to treat, and we need to be more proactive. And it can be worse in this particular setting to combine steroids plus ECP as first-line treatment.
We have one question from the virtual audience, whom I say hello. Whether there is any experience with treatment discontinuation, ECP discontinuation, assuming you have a patient who would like to go on vacation for 2 or 3 months, and then you stop, and then do you resume? Any hint? I know we don't have data or studies, but any experience with this? Zina?
I mean, in acute it's simple, you just stop. But in chronic, that's not a common practice, but as you've seen, some groups do it. So the Nordic group, as per their guidelines, they stop it when, I don't have that experience. We usually, because we're always so happy when it works, you're just, but it's not, let's say, an objective thing. So we usually taper it slowly. But I don't think it should probably, I believe it probably would not make a difference to stop it for some time or
Wonderful.
forever.
Thank you.